I'm Dr. Arjun Handa, plastic surgeon and body contouring expert at Handa Aesthetics and Plastics. Hourglass figure is so widely sought out these days by a lot of my patients. A lot of my female patients come to me and say, "Doc, I want that hourglass figure. I want to look like that." So the question is, what is an hourglass figure in the first place? Well, right here I have an hourglass for you. You can have a look at the shape of this object and determine what an hourglass shape is. Wide at the top, slim at the middle, and then again slightly slim or slightly wide at the bottom. This is characterized as an hourglass shape. This is what all the patients that come to me want. They want a wider chest, slightly wide, then they want a narrow waist, and then they want wide hips and buttocks. Not all of them want this, but this is something which is a recent fad, which is a recent fashion. It has been made popular because of some celebrities, and it is a very in thing right now. So how do we go about achieving an hourglass figure in our patients? Well, the answer is liposuction and fat grafting. In some cases, where we feel liposuction is not a good option, then we have to resort to other procedures to achieve our result. And in some cases, to give a wider and a better bust, we usually employ breast implants. So let's talk about the first thing, liposuction. Liposuction is a process in which we make small cuts 3 to 4 mm in hidden areas of the body and we take out the fat. Using this fat, we can create whatever figure the patient wants. We can use this fat to correct the depression at the hips. We can use this fat to increase the size of the buttocks. We can use this fat to put it into the breast to increase the size of the breast as well. From the back and from the arms, from the waist, from the tummy, we take fat out. And when we are doing buttock contouring, we also take out some fat from the upper part of the thighs because both the areas are joined and one complements the other. So to give a good adequate shape to the buttocks, thighs have to be addressed at the same time. So what are the prerequisites of undergoing liposuction for an hourglass procedure? And the number one thing is that you need to have enough fat in your body. But the fat has to be just right, that is in the Goldilocks zone. Your body mass index should be between 21 and 27. If the body mass index is too high, then there is just too much fat and the narrowing cannot be achieved. If the body mass index is too low, then there is not enough fat to increase the size of the buttocks or the hips. At the same time, sometimes the fat is required to be injected into the breast, then we do that. But sometimes patients prefer breast implants at the same time. The problem is that while we are doing this procedure, breast implants and buttock fat grafting cannot be done at the same time. The reason is in the post-operative period, the patient has to lie down on their tummy so that the fat can survive, it can pick blood supply in the buttocks in its new location. So when we do breast implants, the patient cannot lie down on the chest. So those two things don't go together. If the breasts need to be augmented at the same time, then we usually do that before, and then after 4 weeks we do the liposuction and fat grafting. It's a little difficult to understand when somebody is talking like this, so let's just look at some of the patients that I have done so that I can explain to you better what is an hourglass figure and how we achieve it. So this is a patient of ours who's 26-year-old. You can see that there is some fat present on the tummy. She doesn't really have a very feminine figure. There is a lot of fat in the love handles as well. She is thin from the thighs. So she wanted a very feminine and hourglass figure. So we did a liposuction of the tummy for her, and as you can see, we have created beautiful abs on the tummy. The shape has come out beautifully. But what I want you to concentrate upon is that the fat over here in the love handles has completely disappeared. It has gone. And the curve that we have given by injecting fat into the buttocks and to the hips, this is characterized as an hourglass figure. It is narrow at the waist, and then we have a smooth contour on the buttocks and the hips. So let's have a look at it from the behind. Before the procedure, she had very boxy, small, masculine buttocks. Hardly any volume on the outside of the buttocks, a lot of fat in the love handles, and a very, very poor shape at the thigh and buttock junction. So we did liposuction and did fat grafting in those areas. So you can see, even at 4 weeks, there is a beautiful curve which has come. The hip dips have disappeared. She has good volume on her buttocks. This is the small mark that we made to take out the fat and to inject the fat. These marks usually disappear by about 3 to 4 months and are not seen after that. Let's have a look at some other patients as well. This is another patient of mine who was around 28 years old. Again, a very straight, narrow, masculine, boyish figure. She wanted a more feminine figure. In this photograph, I also have the markings for you. So you can see these two lines which are there. So we take out all the fat from this area so that the waist goes in. And then with other fat also, which is on the tummy and the arms and the back that we have taken out, we wash it, we clean it, we put antibiotics into it, we filter it, and then we inject it into the buttocks and to the hip tips. So when you see the result, you can see that the whole waist area has gone completely in. There is a beautiful shelf which has been created to give projection to her buttocks. And also fat has been added to her hip dips and the buttock itself to give volume. So this is a classical hourglass figure where again you have narrowing at the waist and then volume at the buttocks. When I compare this shape, the hourglass, to this photograph, you can see the similarity between these two. Next, we can have a look at another patient of ours who again, this patient had good volume in her buttocks and a lot of fat in her waist as well. But there were some hip dips present as well. There was quite a lot of fat on her back and arms. So we did arm, back, tummy, lower back liposuction with fat grafting to the buttocks and the hip dips to give her the adequate hourglass figure. And this is the beautiful result. You can see right from the back it's become slim. There is a beautiful curve at the lower back and there is ample volume in her buttocks. This is a result which is given in a 4 to 5 hour procedure. A very important question. What is the procedure like? What is the post-operative period like? And what all needs to be done? Well, the procedure itself takes about 3 to 4 hours to do. And it's done under general anesthesia. So the patient usually requires a hospital admission for at least one night. That is on the day of the procedure. The next day, they can go back home. In the post-operative period, they have to wear a compression garment, which is a tight garment. They have to wear it for 24 hours a day, 7 days a week for 1 month. It has to be worn all throughout the 1 month. It can only be taken off while taking bath. So we provide as usually 2 garments to our patients so that they can rotate it each subsequent day. Apart from that, in the post-operative period, lymphatic massages are required from post-op day 4 to post-op day 14. These greatly help in reducing the swelling and the pain and make the recovery faster. The pain is usually 7 out of 10 in intensity. It's like muscle soreness in quality and it lasts for about a week. After a week, the patients are extremely comfortable. One very important aspect of fat grafting to the buttocks and hip dips is that during the next 6 weeks, no pressure should be put on these areas, otherwise the fat dies. No complications occur because of that, but what happens is the volume that we have given just disappears. So it's very important for our patients to follow our instructions, like not to sit on buttocks. They have to lie down on their tummy. So we usually give them special cushions with which they can sit on their thighs and the pressure does not come on buttocks. So with the use of these special equipments, usually pressure can be avoided. While during travel also, they have to travel either lying down on their tummy or they have to be on their knees while traveling. So sitting in the car also for a very long time cannot be done. So after fat grafting to the buttocks and hip dips, it is very, very important to maintain the viability. But apart from that, usually patients do not have to follow any other instructions. They can return to work provided they don't sit for long periods of time, and that is about it.